An emergency communications centre. Calls are coming in every minute needing urgent help.
How's her breathing going?
I just need you to calm down, okay?
Today, a frantic mum is on the line.
Tell me exactly what happened.
My little boy pulled a hot cup of coffee on him and his skin just all peeled off.
Okay, what part of the body was scalded?
On his face and down his arm and his chest.
Is that him screaming?
Yeah, that's him.
Oh, poor love.
215, receive K1, thanks.
Single responder Mark is being dispatched to the tiny burns victim.
It's my fault.
Just take a deep breath. It's not your fault. These accidents happen all the time. They're coming as quickly as they can, all right?
Oh, that's my spot. Thank you. Hey.
This child's had hot coffee spill on their face and their chest. So the main concern I reckon out of that would be around whether the child's actually had any airway involvement, because that creates a fairly rapid onset of swelling, which can cause breathing problems and essentially the airway to close over.
The patient is only 19 months old, almost the same age as Mark's own son.
Ask any paramedic and they'll tell you that managing sick and injured children is one of the hardest parts of our role. They're helpless, they're vulnerable, and most of the time they don't exactly know what's going on.
G'day.
Come in.
How you going? Mark is my name.
Hi, Mark. Get here.
As I walk through the front door of the house, I can hear this little boy is screaming in agony. It's really tough hearing a child in such excruciating amounts of pain. My heart is beating at 1,000,000 miles an hour. That's how emotional and distressing the scene is.
19-month-old Jaxon is in terrible pain. The toddler pulled a cup of hot coffee off the kitchen bench and has suffered severe burns.
Got 16 to 18% burns, centre of his chest, all the way down, skin's peeling off, and down his full right arm.
Face as well.
Doesn't look like it. Looks like it's just below the jaw. I couldn't see any in his airway.
I think majority.
Yeah, there's no skin peeling off his face.
I was making a cup of coffee. I turned to go to the fridge to get the milk, and Jaxon, in a split second, pulled the hot coffee on top of himself. That's how quick it happened. Seeing him there and looking at how burnt he is, it's gut-wrenching.
He's had the one set of fentanyl, he's due for another set of 2 minutes.
25 mics.
25 mics iron.
Yeah.
And the active cooling is due to finish in 3 minutes.
Which will be 20 minutes, yeah.
Jackson's dad, Jason, did exactly the right thing, putting his son under the shower for a crucial 20 minutes of cold water irrigation. That should help reduce the severity of their son's burns. But now, Mark needs to warm Jaxon up and dress the affected areas.
Jackson's not allergic to anything?
Not anything that I'm aware of.
Come on, Bubba. It's okay. It's okay. Yep. Yep.
It may look a little strange, but in fact, the best dressing that we can apply in ambulance for burns is cling wrap. It prevents ongoing fluid and heat loss from the burn, therefore reducing the likelihood of hypothermia. It's also got a role to play in preventing infection from the burn.
It's okay, mister.
More pain relief is needed. For parents Sharon and Jason, it's hard to comprehend how horribly wrong this day has gone.
Oh, it's every parent's worst nightmare. I could not believe how badly he was burnt. It was just horrible.
Guys, what we're going to do is we're going to give an injection in the leg, okay, which will take control of the pain.
But for a child this small, even administering pain relief is fraught with danger.
So the volume of morphine I'm actually drawing up for Jaxon is minuscule. It's actually only 0.12 of a mil. So it's really important that you calculate that properly, because you could inadvertently overdose this child in the heat of the situation unless you're clear thinking.
Sorry, mate.
Good boy.
Looking at Sharon and Jason, the parents, they are obviously beside themselves. The fact that this accident has even occurred in the first place is probably eating them up. But it's really important as the treating paramedic that I keep them calm and reassured.
Baby's here.
It's heartbreaking to hear him scream because I love him more than anything. Kept holding him, trying to reassure him it was all right.
We're going to get him out to the ambulance now.
In a heartbreaking accident, 19-month-old Jaxon poured a cup of hot coffee over himself. Now, Micah paramedic Mark needs to get the tiny child to the Royal Children's Hospital for further treatment.
Cases involving serious burns are time critical. Now that we've got dressings and effective pain relief on board, it's imperative that we start transporting Jaxon to hospital for specialist care.
I know, mister.
Shattered parents Sharon and Jason are trying to stay strong.
I know, mister. It's okay.
It's very heartbreaking. You just feel helpless as a parent. You just want to take their pain away and you can't.
Hey, Jaxon. Hello, mate. You've had a rough afternoon, haven't you? So has Mum. So has Dad. You're doing a really good job there, Sharon.
As a parent of a toddler myself, I know the kids are so inquisitive and they're always pulling at things, but you can't always have eyes in the back of your head. So I actually appreciate how easily an accident like this can happen.
So I've given him a dose of morphine via the muscle, which I reckon will be starting to take effect now. And he's had 3 doses of a similar drug up the nose. I reckon we've got on top of his pain pretty well, actually.
With Jackson's pain relief taking effect, Mark now needs to assess the little boy's airway.
Oh, no, you're right. Okay. It's okay.
Jackson's making these sort of weird, throaty, chesty sounds, and that raises real concern for me that he's in fact inhaled some of the hot coffee. So it's really important that I work out whether he's in fact burnt his airway, because if that's the case, then I know that it can swell really quickly and it can be a real problem for his breathing.
You're all right, stay there, that's all right.
So I actually inspect the mouth with my torch and I can't really see a whole lot. So although I'm reasonably sure that it's not burnt, I can't actually exclude it there until we get to hospital.
And Sharon, have you got other kids?
Yes, he's a twin.
Twin brother, twin sister?
Twin sister.
Twin sister. What's your sister's name?
Alexis.
Alexis, oh, beautiful names. Yeah. We grew up with a twin sister, mate. I grew up with a twin brother who's a paramedic as well.
Oh, really?
Yeah, yep.
Are you identical?
Yeah, we are, yeah. I taught him a few lessons.
Sharon is showing incredible strength to remain so calm in these circumstances. Not all parents would be able to, and understandably so, but it is commendable that Sharon is so calm and in control.
Arrived at the hospital, mate.
It's okay. Daddy's here. Daddy's here.
Jaxon will receive the best treatment available, but there's no guarantees he won't be left with lifetime reminders.
Definitely worrying about, is he going to be scarred? Is it going to affect him as he grows? So that's a major concern.
Oh, my boy.
And it's been 5 weeks since Mark was called out to rescue 19-month-old Jaxon. The toddler had pulled a cup of hot coffee over himself, causing severe burns. Today, Mark's about to find out what sort of recovery Jaxon has been able to make.
Hi, Sharon.
Hi, Mark. How are you?
Good, how are you?
Good, thanks.
Nice to see you again.
Good, come in.
Thank you. Where's the brave little man?
Yeah, he's just through here. Come through.
Hello.
I'm gonna eat you.
Hard to believe this happy little boy suffered burns to his face, arm, chest and airway, and spent 3 days in an induced coma.
Hey, kids. A couple of teddies for you from the ambulance. How you going, Jaxon? How you feeling, mate?
Say hi.
He looks well, doesn't he?
Yeah, he does. He's back to his happy normal self.
Where he's had the skin graft is still healing, but the doctors are very happy with the way it's going. So he's just bounced back. He's a happy little boy. You really wouldn't know what he's been through by looking at him.
You being calm really helped us
to be calm because you're in control of the situation, and we were just relieved that once you were there, we knew that he was in safe hands.
You guys just did so well as parents on that afternoon. It was a credit to you guys as well.
Thanks,
yeah,
Mark.
that's true.
I'm very thankful to Mark for what he's done for our family to help us in our time of need.
He's a lucky boy, aren't you, mate?